Have you ever noticed that your penis appears curved and wondered whether that's normal? Or perhaps you've been concerned, thinking it should always be perfectly straight. Maybe you've even recently developed a bend in your erection, and it's left you feeling confused or worried. If you've experienced any of this, you're definitely not alone. And today we're going to clarify what penile curvature really means, when it's a normal variation, and when it may suggest something more serious. My name is Dr. Samra. I'm a board-certified urologist and andrologist, and in this video, I'll guide you through the medical facts about penile curvature based on current urological science to help you better understand your anatomy, alleviate unnecessary worries, and take action when genuinely needed. Before I begin creating the next series of videos, I need your input. Tell me what you want to learn more about. Are you struggling with getting erections, or do they not last as long as you'd like? Are you dealing with low sex drive, low testosterone, or concerns about your size? This channel is dedicated entirely to your health, so your feedback is essential. Please comment your age, your weight, your country, and the specific topic you want me to make videos on. Your health, confidence, and improvement are my priority, and your responses will guide the content I create for you. Let's get started. Now, let's begin with this. It's actually very common for the penis to have some degree of curvature. In fact, no one talks about it much, but many men have a natural bend, whether to the left, right upward, or slightly downward, and it's typically nothing to be concerned about. As long as the curvature has been present since puberty or early adulthood and isn't causing any functional issues like pain during erection, difficulty with penetration, or emotional distress during intercourse, it's generally considered a normal anatomical variation. It's just part of what makes your body unique. However, some men become self-conscious about even a slight curve, especially in a world where genital aesthetics are often idealized. But here's a key message. A penis doesn't have to be perfectly straight to function healthily or be sexually satisfying to both the individual and their partner. What matters most is function and comfort, not symmetry. But there's one critical distinguishing question I want you to ask yourself. Has my penis always been this way, or has the curve appeared recently? Because if the bend is something new, especially if it's progressively worsening or accompanied by pain during erections or intercourse, that may indicate a condition known as Peyronie's disease. Peyronie's disease is a disorder we're seeing more awareness around in recent years. It occurs due to the formation of fibrous plaques, essentially internal scar tissue, in the tunica albuginea, the tough sheath surrounding the corpora cavernosa, which are the erectile bodies in the penis. These plaques can cause the penis to bend abnormally during erection, and in many cases, men report pain, particularly in the early or acute phase of the condition. Scientific literature confirms that the disease typically affects men over 40, with prevalence increasing after the age of 50, but it's not exclusive to older individuals. Younger men can also develop Peyronie's, especially following microtrauma that may occur during sexual activity. Another sign to look out for is the sensation of a hardened nodule or lump under the penile skin. This can sometimes be felt by gently palpating the shaft while the penis is flaccid. If you feel something unusual and firm beneath the surface, and especially if it's associated with curvature or pain, it's essential to consult a specialist. Ideally, a urologist with experience in sexual medicine or andrology. Now let's talk about treatment options. The goal with Peyronie's disease, especially in the early stages, is to halt progression and manage symptoms. There is no known cure that reverses it completely, but fortunately, medical science offers several therapeutic avenues. In the initial phase, commonly defined as the first 6 to 12 months after symptoms start, we often begin with conservative treatments. These include oral medications with antifibrotic or anti-inflammatory properties, intralesional injections like collagenase, Clostridium, histolyticum, and non-invasive mechanical therapies such as penile traction devices or vacuum erection pumps. These mechanical therapies help to remodel the tissue, reduce curvature, and even preserve or improve penile length, which is a major concern for many patients. However, in some individuals, especially when the plaque becomes dense, the curvature becomes severe, or erectile dysfunction develops as a secondary issue, surgical intervention may be necessary. Surgery for Peyronie's disease can range from minimally invasive plication techniques, where we straighten the shaft by suturing the longer side, to more complex procedures like plaque excision and grafting. In severe cases, for instance, when men also have significant erectile dysfunction, the placement of a penile prosthesis along with curvature correction may be required. These surgical options are highly individualized and should only be considered after thorough discussion between patient and specialist. Now here's another important scenario. Some men have what's known as a congenital penile curvature, meaning the penis has been curved since adolescence or the onset of erections during puberty. Unlike Peyronie's disease, this isn't caused by scarring or disease. It's simply a result of uneven development between the corpora cavernosa and other surrounding structures of the penis during fetal development. In most congenital cases, the curvature is downward, sometimes known as ventral curvature, and is often identified when the penis becomes fully erect. For many men, congenital curvature does not interfere with sexual function, and no medical treatment is needed. But when the angle is significant, usually considered more than 30 to 45 degrees, it can cause mechanical difficulties with penetration or lead to significant personal distress. In those situations, we may consider surgery to correct the curvature. The procedure typically involves shortening the longer side of the penis through corporal plication or corporoplasty techniques, which are proven and safe when performed by experienced surgeons. It's worth noting that men with congenital curvature often have good penile length, which makes surgical outcomes particularly favorable. Before considering surgery, it's essential to get a professional assessment, physical exams during erection, induced pharmacologically for evaluation, penile ultrasound, or even photographs of the erect penis taken in privacy can provide crucial diagnostic clues. Objective measurements help guide treatment strategy and predict outcomes, so avoid trying to eyeball the curvature. We use tools like goniometers and tape measures to judge the degree and direction of curvature accurately. Ultimately, whether your penis has always had a curve or it developed suddenly, it is vital to understand one important fact. There is help available. You don't need to suffer in silence, nor should you make assumptions based on unrealistic expectations or internet misinformation. Urology Today offers effective ways to diagnose and manage both congenital and acquired penile curvature. I'll leave you with this: your body is unique, and slight differences in anatomy are part of what makes us human. If the shape of your penis isn't causing pain or interfering with intimacy, it might be just a natural variation, and nothing to worry about. But if you're noticing changes, discomfort, or concerns about your sexual function, know that you're not alone, and there are well-established medical treatments available to help you lead a confident and satisfying sex life. If this video brought you new insights or helped answer your questions, don't forget to subscribe for more medically accurate, respectful, and honest discussions about men's health. Feel free to leave your questions in the comments. I read them and take real feedback to heart. Also, check out the membership section where we post exclusive content for our most engaged viewers. Thank you for watching. Take care of your health and never hesitate to seek help when something doesn't feel quite right. I'm Dr. Samra, and I'll see you in the next video.